Good afternoon. On my own behalf and on behalf of the Global Leaders Group on Antimicrobial Resistance, I would like to warmly thank you for the invitation to address you today during your annual meeting. The Global Leaders Group on Antimicrobial Resistance has now been established for over 2 years, since November of 2020, and its aim is to accelerate political action, of course, on antimicrobial resistance based on the One Health approach. In fact, our parent organizations are the World Health Organization, the Food and Agriculture Organization, the World Organization for Animal Health, and the United Nations Environment Programme. The group is co-chaired by Their Excellencies, the Prime Ministers of Bangladesh and Barbados, and it includes heads of state serving all foreign ministers, mostly acting in their individual capacities, together with senior government officials and senior representatives of foundations, civil society organizations, and also importantly the private sector. Clearly, you are all very aware of the challenges that we are all facing, resulting from the growing burden of antimicrobial resistance, exacerbated also by the limited availability, the inequitable access, and the inadequate development of new antibiotics. Indeed, these limitations are very well outlined in your progress report, which makes excellent reference to the very aptly described broken antibiotic market. And you zoom in on this issue very well, and you bring together key action areas, useful updates, and examples of work done with both push and pull initiatives for development of new antibiotics. There is, of course, great value in such timely and informative reports, which make useful tools for decision making and for the creation of innovative solution based on science. And in fact, the providing of regularly providing facts and evidence that are already available is important to fuel discussion and to add credibility and trust all around. I would add that surveillance, not only in human health, but also in animals and in the environment, is essential to continue to map out the full extent of the AMR problem. Your work is well aligned with that of the GLG, and especially of our GLG Action Plan Priority Number 5 on R&D, which calls for increased effective and affordable innovations across all sectors, and to secure a sustainable pipeline for new antimicrobials, for vaccines, diagnostics, for waste management tools, and for the safe and effective alternatives to all of these. And then, of course, to ensure equitable access to them all on a global level. The GLG has actively engaged in meaningful discussions, which have, among others, led to the unblocking of the Codex Alimentarius negotiations, and we continue to advocate for increased financing for AMR activities across sectors, including for the development of new antimicrobials and for investment in research and development. The Global Leaders Group on Antimicrobial Resistance will continue to collaborate globally with governments, with agencies, with civil society and the private sector, mostly to advocate for the size of political action, both on a global, regional level, but also granularly on a national level. In fact, this advocacy has led to the United Nations General Assembly agreeing to hold and to host a high-level meeting on AMR in 2024. It is up to us, up to all of us, to make sure that this high-level meeting is an opportunity which we cannot miss, and that we need to make sure brings AMR even more forward onto the global agenda. The existence of creative thinking space and discussion spaces, such as the Global AMR R&D Hub, as an incubator for the creation of innovative solutions for AMR, is also, of course, well appreciated. And it is heartening to see that the Global AMR R&D Hub also participated in our CHOGM side event in Kigali last June in Rwanda, and we take this opportunity to thank you for the recognition of this and other work of the GLG also in your fact sheets and newsletters. We look forward to hearing more on the working of your newly set up One Health group, and it would be useful to explore further collaboration between you, and especially on the One Health aspect and the GLG. So once more, I thank you very much for this opportunity and for the valuable work that you are doing. All of us are in this together towards saving lives which would otherwise be lost due to AMR.